ASIS, and I lay my hand right on the patient, and then the radial border of my hand is my incision. So it's a pretty good reference. Now, I got a big hand, so if it's a small patient, I'll move it a bit medial. If it's a big patient, I might move it a little bit lateral, but that's a pretty good reference. And as Paul mentioned, from proximal to distal, you want to be a bit medial to lateral, and he talked about shooting this towards the fibular head, which is where my incision is pointing to. The proximal extent, well, if you make it a little bit more medial, this will help with femoral preparation. The distal extent being a bit more lateral will help with acetabular preparation. And, I don't make a real small incision, so that's going to be about an average size incision. And for this demonstration, I'll make it a little bit longer so we can be sure that everyone can see. One thing that will happen, especially if you're just starting this, is you can really butter up the skin edges. So making the incision maybe just a little bit longer is probably helpful, but you do want to stay out of the inguinal crease. So whatever you do, you really don't want to make a cut up in the inguinal crease. Now, for a really thin patient like this, probably not as big of a deal, but when you have the obese patients, you strongly prefer not to extend proximal of the inguinal crease. Okay, so do we have